For more, we connect over to our reporter Kim Yeon-seung, who's been out since this morning at one of the COVID-19 testing centers that's trailing the new virus response measures. So Yeon-seung, tell us where you are and what changed with the new virus response.
Well, Mok-yeon, I'm at a public health center in Anseong city of Gyeonggi-do Province. And it does seem a little empty right now, but that's because these health workers are out on their lunch break. But I've been here since early morning, and I've seen one of the most visible differences here is that they have now two lines. So one line is for people who are receiving their PCR tests, and another are for those who are receiving their rapid antigen tests. Someone who's not considered high risk, who's younger than 60 or doesn't have a health risk, or who is in class as a close contact with a confirmed patient should get the rapid antigen test first. They'll have to wait here for 15 minutes until they get their results, and if they test negative, they're good to go. But if they test positive, they'll have to stand once more in the PCR line to get tested. I've talked to the director of this public health clinic, and she said that she did feel a little uneasy about this change because the rapid antigen tests are not as accurate as the PCR tests. But she still thinks this change is necessary to cope with the Omicron spike. Take a listen.
When Omicron infected cases increase, we won't be able to test them all with PCR. That's why we need rapid antigen testing first.
Right, then how does it seem over there? Does it seem like things are really moving along more efficiently?
Well, it's still the first day, so this morning there seemed to be a lot of confusion. For example, like public health workers were out helping with the rapid antigen self-test kits, even though these test kits are supposed to be self-administered. So according to the director, this is because not many people know how to properly use these self-test kits. But sooner or later, it's going to get to the point where the health workers won't be able to handle the overwhelming number of people who need to get tested. And that's when these health test kits will really start to shine, and they'll be used to test more people efficiently without putting too much of a burden on the health workers here. Mok-yeon, I'm also going to stay here and get tested myself to really try out the system. So fingers crossed on that I don't confirm positive. Back to you, Mok-yeon.